Chronic respiratory diseases is not only a clinical issue. It is an issue, it's a broader societal issue. And actually, the lungs are actually paying the price for policy failures in other areas.
We just had a panel discussion on how we turn political commitment into action. And one of the key takeaways is that we need to start having clear budget lines that are dedicated to respiratory health. The second point is we need people. So having those people that are really dedicated and are going to be helping move the needle in the system.
Most of the people live on the coast of Guyana, which means that there's a lot of forested areas, small communities, maybe 300, 400 people living in these communities. So they're really, really hard to reach. And one of the things that we as a government wanted is to ensure that regardless of where you're living, that you can benefit from care. A community health worker can now deliver expanded care, which include respiratory care. We have seen that that has really changed outcome for a lot of our patients.
At the TB Caucus, we have always advocated for integration with other health diseases, and including chronic respiratory diseases. At the end, it's a person with a pair of lungs that's not working properly.
When we think about integrated care, it means empowering patients to take better control over their lung health or their COPD or asthma. When we think about COPD or asthma, there's so much stigma around it and there's so much invisibility there. And I don't think anyone who doesn't live with it can really understand what it means to struggle to breathe.
I always say health is wealth. And when we are talking about the respiratory health, we are talking about someone who is either part of the society, functional, fully giving, or just on a device at a hospital.
Integrated, innovative, and well-resourced.
It needs to be based off just everyone having the right to breathe.
Challenged, time-sensitive, crucial.
Our ambition is that respiratory health is put at the same level of recognition and action as cardiovascular diseases and cancer.
Breath may be biological, but the future of lung health is determined by policy.